Hi, and welcome to our channel. I'm Barton from Pass the NCM-HCE, and today we're going to dive into the difference between persistent depressive disorder, prolonged grief disorder, and bereavement. So let's get started. Persistent depressive disorder is a chronic form of depression. It includes a depressed mood that lasts for at least 2 years, along with other symptoms like poor appetite or overeating, insomnia or hypersomnia, low energy, low self-esteem, poor concentration, and feelings of hopelessness. Unlike major depressive disorder, persistent depressive disorder is less severe but more enduring. And again, that's 2 years, and that's for adults. In children and adolescents, it would be 1 year. Prolonged grief disorder, just added to the DSM-5, I mean, that's how new it is as far as a diagnosis, is also known as complicated grief. It's a condition where the normal grief process is prolonged and actually becomes debilitating. Symptoms include, intense yearning or longing for the deceased, a preoccupation with the deceased, difficulty accepting the death, emotional numbness, and difficulty engaging in life. These symptoms persist for an extended period of time, and for a diagnosis, the death must have actually occurred at least 12 months ago for a person or of a person that was a loved one or very close to the bereaved individual. And for children or adolescents, it has to be at least 6 months. And again, to keep in mind, it significantly impairs daily functioning. Now, then we get to bereavement. Bereavement is a period of mourning and grief following the death of a loved one. It includes feelings of sadness, yearning, and longing for the deceased, as well as other emotional, cognitive, and physical reactions. Bereavement, however, is kind of what you would see pretty normally, and it's a natural and expected response to loss and varies greatly, however, among individuals. But it typically involves an acute period or phase, certainly immediately following the death normally, and then there is a gradual adjustment to life, without the deceased. It's not to say that the individual won't always be sad to some degree, but they sort of get back to life and begin functioning once again within society. So, in summary, we looked at persistent depressive disorder, prolonged grief disorder, and bereavement. Again, PDD or persistent depressive is an extensive period of depression, not as quite as bad or chronic as major depressive disorder. However, it is less severe, right? It is less severe than major depressive disorder. When we get to prolonged grief disorder, well, it actually requires the loss of a loved one or close friend to the individual who is bereaved, and it has to have been at least 12 months, 6 months for children or adolescents, and it is debilitating. It is debilitating. And then bereavement, which we might say is the normal response to death or the passing of a loved one or close friend. And there's no defined period of time as far as the duration or anything, just what we might expect after the death of a loved one or close friend. And that's about it for today. So if you like these little summaries, please continue to tune into our channel. Again, Barton at passthencmhce.com. And if you'd like to see what other action we have going, which is quite a lot, that is full 20-hour DSM presentation, deep dives. In fact, first 3 weeks in February, we're going to be covering over 30 different diagnoses in the top 6 diagnostic categories. So again, go to the website, passthencmhc.com, and see what's going on. All right. Thanks for joining and have a good day.